Anxiety disorder is a mental health condition characterized by excessive and persistent worry, fear, or anxiety that interferes with daily activities. While feeling anxious in response to stress is a normal part of life, people with anxiety disorders experience intense, excessive, and prolonged anxiety that can be overwhelming and difficult to control. Types of anxiety disorders. Generalized anxiety disorder, GAD. People with GAD experience chronic exaggerated worry and tension, often without a specific cause. This condition can lead to physical symptoms like restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbances. Panic disorder. This disorder is marked by recurrent and unexpected panic attacks, sudden periods of intense fear that may include palpitations, sweating, trembling, shortness of breath, chest pain, and a fear of losing control or dying. Panic disorder often leads to avoidance of situations where panic attacks have occurred. Social anxiety disorder, also known as social phobia. This disorder involves overwhelming worry and self-consciousness about everyday social situations. People with social anxiety disorder fear being judged, embarrassed, or humiliated in front of others. Specific phobias. These are intense, irrational fears of specific objects or situations, such as heights, animals, or flying. Exposure to the feared object or situation can cause severe anxiety or a panic attack. Obsessive-compulsive disorder, OCD. OCD is characterized by persistent, unwanted thoughts, obsessions, and repetitive behaviors, compulsions. The compulsive behaviors are often performed in an attempt to reduce the anxiety associated with the obsessions. Post-traumatic stress disorder, PTSD. PTSD can develop after exposure to a traumatic event. Symptoms include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. Symptoms of anxiety disorders. Common symptoms of anxiety disorders include excessive worry or fear, feeling restless or on edge, difficulty concentrating, irritability, muscle tension, sleep disturbances. Physical symptoms such as sweating, trembling, dizziness, or a rapid heartbeat. Avoidance of situations that trigger anxiety. Causes and risk factors. The exact cause of anxiety disorders is not fully understood, but a combination of factors is believed to contribute, including genetics. A family history of anxiety disorders can increase the risk. Brain chemistry. Imbalances in neurotransmitters, which are chemicals that transmit signals in the brain, can play a role. Environmental factors. Stressful or traumatic events, such as the death of a loved one, abuse, or ongoing stress, can trigger anxiety disorders. Personality. Certain personality traits, such as being more prone to stress or negativity, may increase susceptibility. Diagnosis. Anxiety disorders are diagnosed through a comprehensive evaluation by a mental health professional, which includes discussing symptoms, medical history, and sometimes psychological questionnaires or assessments. Treatment. Effective treatment for anxiety disorders often involves a combination of therapies, including psychotherapy. Cognitive behavioral therapy, CBT, is particularly effective, helping individuals identify and change negative thought patterns and behaviors. Medications. Antidepressants, anti-anxiety medications, and beta blockers can help manage symptoms. Lifestyle changes. Regular exercise, a healthy diet, adequate sleep, and stress management techniques can significantly improve symptoms. Support groups. Sharing experiences with others who understand can provide emotional support and practical advice. Living with an anxiety disorder can be challenging, but with the right treatment and support, individuals can manage their symptoms and lead fulfilling lives. It's important to seek help from healthcare professionals and build a support network of friends, family, and mental health resources. Understanding anxiety disorders and taking proactive steps to manage them can lead to significant improvements in overall well-being and quality of life. If you or someone you know is struggling with anxiety, reach out to a healthcare provider for guidance and support. Anxiety disorders are complex and varied, affecting millions of people worldwide. Recognizing the symptoms, understanding the different types, and knowing the available treatments can empower individuals to seek help and take control of their mental health. With the right approach, those living with anxiety disorders can achieve a sense of stability and peace.